Coronavirus immunization will help shield you from getting COVID-19. You may have some results which are ordinary signs that your body is building assurance. These results may influence your capacity to do day-by-day exercises, yet they should disappear in a couple of days. What are the common side effects you may experience after getting a COVID-19 vaccine? The conceivable results of an antibody may incorporate torment, redness, irritation or expanding at the infusion site, which may last a couple of hours, fever, sensation of shortcoming or weariness, migraine, dizziness and sometimes looseness of the bowels. Common side effects on the arm where you got the shot includes pain and swelling. To reduce pain and discomfort where you got the shot, apply a clean, cool, wet washcloth over the area, use or exercise your arm. However, some effects may also be throughout the rest of your body. This includes fever, chills, tiredness and headache. To reduce discomfort from fever, you may drink plenty of fluids and dress lightly. In the event that you have torment or distress, consult with your primary care physician about assuming control over the-counter medication. By and large, inconvenience from fever or torment is typical. Contact your physician or medical care supplier. With both COVID-19 mRNA immunizations, you will require 2 shots to get the most insurance. The circumstance between your first and second shot relies upon which antibody you got. Remember, results can influence your capacity to do everyday exercises, however, they should disappear in a couple of days. It requires some time for your body to assemble security after any vaccination. Coronavirus immunizations that require 2 shots may not secure you until possibly 14 days after your subsequent shot. The Philippines vaccination crusade is focusing on medical service laborers, police, and military faculty at first. It has additionally arranged stockpile manages different makers, expecting to immunize 70 million individuals, or 66% of the populace. It's significant for everybody to keep utilizing all the instruments accessible to help stop this pandemic as we study how COVID-19 immunizations work in certifiable conditions. Cover your mouth and nose with a veil when around others, stay at any rate 6 feet from others, evade swarms, maintain a strategic distance from ineffectively ventilated spaces, and wash your hands often. Philippines got its underlying cluster of COVID-19 antibody portions in a shipment donated by China. There is no reason to hesitate in getting a COVID-19 vaccine despite the presence of new variants of coronavirus in the Philippines. Now that there are authorized and recommended COVID-19 vaccines, we should still maintain the basic safety measures for everybody to be safe. Wearing masks and social distancing help reduce your chance of being exposed to the virus or spreading it to others. Stopping a pandemic requires using all the tools we have available. As experts learn more about how COVID-19 vaccination may help reduce spread of the disease in communities, health authorities will continue to update the recommendations to protect communities using the latest science. With most COVID-19 immunizations, you will require 2 shots with the goal for them to work. Get the second shot regardless of whether you have results after the initially shot, except if an inoculation supplier or your primary care physician discloses to you not to get a subsequent shot. Here's a study how fast the virus is transferred. This study also shows how infections is possible depending on how you practice safety measures. Stay healthy, stay safe.